My daughter was a senior at Lincoln. She had been on the cheerleading team. She was just a blessing. She wanted to go to school to be a psychiatrist. And the day that my daughter was killed, when I went and got the mail, my daughter had just got her first acceptance letter to Cal State Dominguez for a scholarship to college.
When my 21-year-old son, Jaime Bravo Jr., was murdered, he didn't die alone. They killed me and my entire family. And I went back to work, and my director at the time said, "Bevelyn, how long are you going to continue to help mothers bury their kids? Is there something that you can do before this happens?" And so I went home and I started thinking about that question.
In 2020, the United States experienced a 30% surge in homicide rates, our country's highest year-over-year increase in more than a century. When violence happens, communities are often left asking what they missed and how can they prevent the next homicide and the one after that. The Violence Reduction Council is a new approach to addressing violence in our communities. What's different about violence reduction councils is that they're a public health approach to what has mostly been, up to now, a law enforcement problem.
It starts with a different set of tools than the ones law enforcement uses when tackling homicide. Data is the essential element of good decision-making, and data from different frontline practitioners can give us a much deeper picture of what's really going on. Law enforcement still has an important role to play, but so do many others. At the heart of this public health approach is a new framework for gathering and understanding data that weighs relevant situational factors to give us that deeper perspective.
To create this environment of trust and collaboration, violence reduction councils offer the community a big tent. Each council is led by a neutral convener, many with a background in public health. This person manages the 3 pillars of the Violence Reduction Council: the Criminal Justice Review Committee, which looks at factors such as victim and suspect history and motive, as well as points of missed opportunity for intervention. The Community Service Provider Reviews focus on local knowledge in each case, as well as perspective on violence in the neighborhood and priorities for enhancing public safety. The Executive Committee, the 3rd pillar, is comprised of both municipal and agency leadership with the job of making recommendations based on the data and then evaluating the impact of these decisions on violence.
Sometimes it's hard at night for mothers, they're crying at night, they're missing their baby. We just want them to know that we're here for you, that it is a long journey.
So when we tell them our story, would you like your mom to be in our shoes? And none of them to this day, and I've spoke with hundreds of youth, none of them have ever said yes. They all say, no, we don't want our mother to be you.
In one city we worked with, we found that non-fatal shooting data has been key to preventing follow-on shootings and homicides. The Violence Reduction Council model in another city allowed law enforcement to design a more effective witness protection program customized around that community. These are the kind of ideas that get shared between our Violence Reduction Council partners and can produce much better outcomes for everyone. In Milwaukee, where violence reduction councils were pioneered, we were able to achieve close to a 50% decline in homicides using this public health approach.
The whole premise here is one of prevention, of being proactive before the homicide occurs, rather than reactive after the fact. Our project, funded by the Bloomberg American Health Initiative, has developed a comprehensive toolkit, data system, and trainings to help communities establish violence reduction councils of their own. Today, there's a new public health approach to violence prevention. Come explore the possibilities and help us advance violence reduction councils across the country.